Hi guys, it's Tammy McClish. Today we're going to be talking about meaningful use. Now you may wonder, why are we talking about meaningful use? I've never heard of this before. Well, think about this. Let's say that you go into a physician's office and the physician gives you an order, and this order is for a blood draw. So you go to the lab and you have the order in your hand, and then you walk into the laboratory, and then the person that's going to draw your blood, which is a phlebotomist, starts typing in the order. And then they pick the tubes and they start drawing the blood from the tubes. And you're like, this is good. I've got a Band-Aid. It's all good. And then a couple weeks later, you get a bill in the mail from your insurance company saying, hey, you're going to owe $125 for this blood test. And you're a male, and it was a pregnancy test. And you're like, what happened? That's called the Swiss cheese effect. The Swiss cheese effect is where that the slices of cheese were set up in such a way that hopefully we could stop an error from occurring. But unfortunately, somebody screwed up along the way. And now we have a male that had a pregnancy test. And hopefully the phlebotomist would have caught that, or hopefully the lab tech, when they received the specimen, would have caught that, or hopefully the insurance company would have caught that, but your wife caught that. And your wife said, why are you having a pregnancy test? You're a guy. So this is why we want to talk about meaningful use, okay? Now, before I talk about meaningful use, I need to talk about another term which was on my screen over here, but it's way up high and I can't bring this any further down. So I'm just going to go ahead and share my screen. Okay. Yep. Let me cancel that. Let me minimize this. See, I'm learning myself. So let me share my screen with you. And what we're going to do is we're going to talk first about something that is called order entry, computerized order entry, or CPOE. So, yes, I am sharing the correct screen. Okay, so you are working for a hospital or a doctor, and the doctors have to utilize something that's called CPOE through meaningful use. This all comes down to this. The Centers for Medicare and Medicaid, meeting the required objectives of the Medicare and Medicaid electronic health record incentive programs is a high priority for most medical practice managers and their employees and staff. Failure to meet even one of the objectives established by the Centers for Medicare and Medicaid, CMS, results in ineligibility of professionals receiving incentive payments. A key element of the incentive program rules is the requirement that only credentialed medical assistants or licensed healthcare professionals, such as a radiology technologist, a phlebotomist, somebody that is licensed, a nurse, a doctor, they are the only ones permitted to enter medication, laboratory, radiology, diagnostic imaging orders into the computerized provider order system, which is called CPOE, that counts toward the Centers for Medicare and Medicaid's meaningful use threshold. Now, this started back in 2015, but it's detrimental that we know about this right now and that we know how to take care of this. Okay, so it is CPOE, which is, and I have to look at the word to make sure I'm saying it right, computerized order entry for meaningful use. Okay, so your physicians that are out there need to make sure that they're ordering the exams and that the people that are typing in all the paperwork are licensed so mistakes aren't made. Okay, so let me move on from there. And what we're going to do is we're going to talk a little bit about a couple more terms. So I'm going to stop sharing my screen. We're going to talk about EHR and EMR. EHR is an electronic health record, and EMR is the electronic medical record. So what we need to do is we need to protect these so that everything that goes into them is going to be perfect. If we have a patient that comes in for a blood draw, we want to take that blood draw and we want to put the results into the patient's medical record. So this is no different than when I had an actual piece of paper that had all of my records in there. So let's say that this is my electronic medical record. This is owned by my physician. This is owned by my doctor. What's inside of those, that is what is mine. So I can get the reports that are inside my electronic medical record, though the medical record itself is owned by the doctor. It's owned by the hospital. So the EMR, the electronic medical record, is this, or it's that file folder on your computer at your doctor's office or in your hospital. That is owned by the facility. So if you go to the Cleveland Clinic, they own your electronic medical record. But everything that's in there is mine. So if I want to know what were the results from when I had my blood drawn, I can request by record to see that particular record, okay? Now the EHR is the electronic health record. And that's all of the stuff that comes in from the physician's offices and the doctors. That's like all your demographics. Where do you live? What's your telephone number? So that's like the whole big encompassing term. But the EMR, electronic medical record, is just like this little file folder over here. Think of it the same way. Now, here's where it gets kind of confusing, okay? So if I have a patient that comes in and the patient walks in with an order and that order is for a chest x-ray. A chest x-ray is a procedure. No different than a patient coming in to have their blood drawn. That's a procedure. So I need to have something called a CPT code, and that is a current procedural terminology code. Now those don't change that often because, I mean, face it, in 1980, they developed the MRI. So the MRI has been around since 1980. Ultrasound's been around since like the 1960s. Those are procedures. Now, for instance, my physician is going to inject my muscle under ultrasound guidance. That's a procedure. So he's going to have to find a procedural code, or his ultrasound tech will have to find that. And then that's going to be documented and it's going to go on to my insurance company. So when I'm working as a phlebotomist, as a medical assistant, or as an x-ray technologist, I receive orders coming from the physician's offices. When that order comes in, I look at it. And then as a licensed healthcare professional, I need to go into the computer and I need to type in all the information I need to type in so that a requisition pops out. So when my patient walks in with a script from their physician, or if I pull it off of the fax machine, that script is the order for the patient. On that order, there will be a procedure, an EKG, an x-ray, lab work, and that is called a CPT. There will be a code associated with that. Let me share my screen again because I'm going to talk about CPT codes. Now, these have not changed in the last several 10, 20 years. So a CPT code is called a current procedural terminology code. Now, they will update the book every year, or they will update the website every year, but the reason they're doing that is if things need to be tweaked a little bit. For example, I think about 5 years ago, the Centers for Medicare and Medicaid said, you know what, we no longer want to use bilateral hands. I want you to say that it's the right hand x-ray or the left hand x-ray. They got rid of bilateral hands. You know, some things they get rid of. So we need to go in and we need to make sure that the right hand is ordered, and we need to make sure the left hand is ordered. So let me click on this for a second to show you, and this is just somebody that has some codes out there. I really don't like that. Let's go to something else. Let's go to here. No, that's the same thing. I am so sorry. I had it up previously. Oh, here we go. Okay, so there's somebody called the AACP. The AACP, they are people that will have individuals go to school for coding. These are coders. So what they can do is they can teach you about these codes. But for me being an X-ray tech, let's say that I'm working and I needed to see a procedural code for the heart. I know that those are going to be from 7557 to 75574. And I can go in and I can look at those codes. So if I'm just looking for radiology codes, I can go in and I can say, it's diagnostic imaging. What are all the codes associated with diagnostic imaging? And then it gets a little bit hairy-carry here because I have to find it in the computer. So let's do this a little bit easier. Let's use our little Google search engine and let's say, what is a CPT code for a chest x-ray? And if you are an x-ray tech, you know that there are a lot of codes for chest x-rays. So the code is going to start off with just 71010, which is a single view chest x-ray. And then if you were going to order a 2-view chest x-ray, would be 71020. So what I do as an x-ray technologist, I look at those codes. I get the order from the physician, I look at it and I say, okay, they're here for a chest x-ray. All right, 2-view chest x-ray. Okay, I'm going to order 71020. Great. Then I look at this thing right here called the ICD-10. That is the International Classification for Diagnostic Codes, 10th version. We just went to the 10th version several years ago. Prior to that, we were on the 9th version, which we were very comfortable with. The 10th version is really different. And the reason that we changed CPT was because ICD-10 was coming out. And that's when we said, okay, we need to perk this up so we can get things the right way. CPT is procedural, x-rays, CAT scans, blood draws. ICD-10 is diagnoses, anemia, COPD, pain. So that's the difference. So if I have a chest x-ray that comes in, and if I look at the ICD-10 code and the ICD-10 code says that the patient is having jaw pain, I'm going to question that. I'm going to perform my job with a questioning attitude. I'm going to say, well, that makes no sense. Why would I be doing a chest x-ray for jaw pain? And I'm going to talk to the patient. And the patient's going to say, oh yeah, I'm having chest surgery. I'm having surgery in my jaw, and they just want to go ahead and have a chest x-ray to clear my lungs. I'm good with that. But if the patient comes in and they'll say, no, there's nothing wrong with my jaw. I'm going to surgery because I have a kidney stone. I'm going to question that. I'm going to make sure that that code is correct. I'm going to call the doctor's office and I'm going to fix that because I'm a licensed professional. That's why CPOE is out there and that's why meaningful use is out there because I'm licensed, I'm bright, I understand procedures and diagnosis. I need to make sure they match. If they don't match, I got to fix it. Just like if a patient comes over from the ER and their right hand is bleeding, but the order says a left hand. I need to check, the requisition says the left hand. I need to check the order to make sure it's right. And so I go into the computer, I look at the order and I'm like, oh, that's wrong. And then I call people and I get things fixed. So let's take a look at ICD. I'm going to share my screen again. And here is ICD-10. So ICD-10 is the International Classification of Diseases. We are in the 10th version. And that is coming through the Centers for Medicare and Medicaid. And it's a website that I can go to. I can click on the website and I can go ahead and look for diagnostic codes. Now, when I work as a radiographer, I have these all over my hospital so I can see these. So like, let's say that I have a patient that comes in and I just want to click on something real easy here. I'm going to go to this ICD-10 index right here, ICD-10 CM index. And I'm going to go ahead and my patient has anemia. Okay, I'm doing a blood draw, they have anemia. So I'm going to click on A. And then I'm going to go all the way down to anemia because I'm looking for a code. I can't do my x-ray without a code. So I go all the way down to anemia. I got to be able to spell anemia. That's why I had med term. Anemia. There we go. Look at that. Look at all those different ones. Well, oh, I thought I was done. So now I got to go back to the patient and I got to say, what kind of anemia do you have? Do you have atypical anemia? Do you have idiopathic anemia? What kind of anemia do you have? And that's why these codes are not always going to be easy. So it's not always going to be easy peasy. We have to do a little bit of investigating. If not, then what's going to happen is that your insurance company is going to call you and they're going to say, can you call your doctor? Because your doctor did not put in the right code for anemia, and we're not going to pay for that test. And until you get that code fixed, you're going to have to pay for that test. And that's why we need to be very careful when we're working with patients. So in the patient that received the pregnancy test that was a male, you need to make sure that you look out for near misses. You need to make sure that you're the one that fixes it before it becomes a miss. A near miss is bad enough. A near miss is like, did I see that right? This patient's a male and he's getting a pregnancy test. I better check on that. That's a near miss. The fact that I'm like, there is no way that this guy is getting a pregnancy test. I call the doctor and I'm like, are you sure you have the right procedure? And they'll say, let me see. Oh, I am so sorry. It wasn't pregnancy. It was hormone levels. Hormone levels for testosterone. Well, that's a big difference. And I need to fix that before it goes on. And then you as a patient catch that, because then you're not going to be very happy with me as a medical professional. So it all comes down to this. There are offices out there. There are places out there that have people that are doing this and they're not doing it right. If you're a licensed professional like me, you're a medical assistant, you're a phlebotomist, you're an x-ray tech, you're a mammographer, I'm also a mammographer, whatever you are, make sure you check these orders. We always check the patient's date of birth. We always check the patient's name. The next thing we do is we grab the order from the doctor, which is the script, and we look at what is the procedure. Procedure is a chest x-ray 2-view, and that 2-view, and you'll know these codes. The 2-view is 71020. And that matches up to my ICD-10. And my ICD-10 is for myeloblastic anemia, which is a diagnostic code of D as in dog 46.9. So it's that easy. So hopefully this is helpful for you, because I know that working in the medical field is so stressful. I don't want to make life stressful for you. So hopefully this is helpful. All right, you guys have a good day, and happy St. Patrick's Day. Bye-bye. I have to find the stop button. There it is. Bye.